You have to be an advocate for your own health and your family's health. You have to make the choices and make your health and make prevention a priority.
I dug in my heels and I began a new lifestyle, and it is a lifestyle.
You have to realize when you have a chronic condition that you have the condition. It's your responsibility to get the help you really need.
It all starts with you. You are the one that is in control of your own destiny.
Major funding for My Health Counts provided by Blue Cross Blue Shield of Western New York. Take time to exercise daily, eat healthy and reduce portion sizes. Limit TV and computer screen time. With additional funding provided by Catholic Health. See us in a new light. Atwal Eye Care Associates. Change the way you see. And the McGuire Group, offering 24-hour skilled nursing care with 5 convenient locations in Western New York, with foundation support by Aligning Forces for Quality, an initiative of the Robert Wood Johnson Foundation, the John R. Oishei Foundation, a catalyst for change, and the Robert J. Stransky Foundation, produced in partnership with the P2 Collaborative of Western New York.
I'm Susan Hunt, and today we'll talk about extending your health care beyond the exam room walls and into your everyday life. We'll help you understand your personal health status and show you how the choices you make each day affect your health. More and more, we're facing chronic conditions and are being asked to make important decisions about our own health. That can be a frightening prospect or an empowering one. The best health care starts with you.
Did you walk 30 minutes today? Are you eating the right types of foods? Are you avoiding excessive tobacco use and alcohol, and do you have a healthy response to stress? Then we can talk about your medications. Then we can talk about your care management. To date, we've pretty much said, you make your own choices and the doctor will fix you. No, you make your own choices and you'll live with them for 70 years.
Do you want to be happy, healthy, and ready and active to go and do what you want to do? Or do you want to be medically managing a health condition? And I think that's your role. If you're already managing a medical condition, how well do you want to control it?
Unfortunately, most people over 40 have at least one of these conditions, and most people over 60 have at least 2 of them. You can manage them by doing nothing, or you can manage them by being proactive. So the decision isn't whether I'm going to manage or not. It's just your management style and what sort of quality of life you want living with these conditions.
I'm joined by Dr. Doriane Miller and patient advocate Trisha Torrey, and we're going to talk about what we can do to manage our own health. It's great to see both of you, and I know we're going to have a very spirited conversation. Dr. Miller, let me start out with you, and let's talk about the definition between acute and chronic disease, because I think a lot of people get confused about that.
I think the best way to describe the difference between acute and chronic disease is to do so by an example. An acute illness is a cold or a rash or urinary tract infection, something that's brief, self-limited. You can take medication for it and usually expect it to go away and you recover completely. Chronic health conditions are diseases in which they usually develop over the course of a lifetime at sometimes, and people have risk factors for them. Either they've inherited a risk factor for something, or they may have a health behavior or a lifestyle that might contribute to the development of a chronic health condition.
And you know, when we talk about this, it's really about the patient taking ownership of their own health care. It isn't just the doctor that you hand over and say, here, take care of me. You have to own it, don't you? It's about an attitude.
You know, for so long, we have deflected responsibility to the professionals, asked them to take care of us as if we didn't have to take care of ourselves. And in truth, it's our responsibility. It's our body. Doctor can't be there 24/7 to take care of us. We have to do it ourselves.
And I think that also the concept of wellness for some people is the total absence of disease, and that you don't have to take medications, you're perfectly healthy. But one of the ways that one might think about wellness is that you are the healthiest that you can be given the health conditions that you're living with.
There's always that laundry list, isn't there, of things that we should be paying attention to. Am I right?
Absolutely, and it's always the same list. You'd think it would be drilled into our heads by now, wouldn't you?
Well, yeah, and let's kind of go over a few of those things that usually would pop up on a list.
What kinds of things were you taught in your health class in 6th grade? Oh my goodness. Eating healthy food. We've got this beautiful bowl of apples in front of us, and an apple a day certainly keeps the doctor away. But in fact, making sure that you have a healthy diet, you stay involved in some sort of physical activity most days of the week for a sustained period of time, making sure that you don't smoke cigarettes and that you don't overindulge in alcohol. Those are the kinds of things that, in terms of health behaviors, that can actually prevent a lot of chronic conditions from occurring. But when they do occur, prevention is still very important, because it's those same behaviors that can help to minimize the level of severity of illness if you happen to develop a chronic condition.
And so this really is you and medical science and your doctor working together to manage the emotional and physical elements of whether you're managing a disease or just developing that healthy lifestyle to make sure you're on track.
It started right after my blood test. I had type 2 diabetes, which seems to be all the rage these days because everybody's got it. And that upset me very much.
It really does feel bigger than you when you have a diagnosis that you know you will have for most of the rest of your life. But I can think of a lot of people who have said, this is not going to be me.
I dug in my heels and I began a new lifestyle. And it is a lifestyle. It's not something that's going to stop anytime soon, because it's too important that I'm able to move around. And I'm moving better than ever. A wrap, please. We're cooking healthy, and we sit at the dinner table. We watch our portions. It was incredibly hard, and then it got easier.
It really empowers people to see how much of that chronic illness they can impact.
I started at 200 and have lost 30+ pounds.
Your body mass index is significantly lower than it was. Your blood pressure looks great, and your labs say you don't need any medication for diabetes right now. So that's,
I will never be cured because I have high sugar levels. But if I can keep doing what I'm doing, I can manage it, and I can stay away from insulin. It all starts with you. You are the one that is in control of your own destiny.
You know, it's interesting when you think about taking control of your own health. For starters, it really is something that seems so new, but it really isn't, is it?
It really isn't, and I think that one of the things that makes you take control of your health is if you set goals for a particular thing that you'd like to accomplish. In ways in which we set a goal to save a certain amount of money to buy a house or to send our child to a particular school. If you don't set a goal, how do you know what you're going to do, and how do you know if you're going to get there? And so I think that goal setting is really important, but change is incredibly difficult.
Oh, really? Difficult. Nobody likes change, do they? Especially if it has to do with their health, because it means I might have to give something up.
And that's how we look at it. Too often we look at it like we're giving something up, when in fact what we should realize is on the other end of it, we're actually regaining something we wish we had. And, you know, giving something up, giving up salty or sweets or whatever those kinds of things that we traditionally have learned to like. If we start working on changing our habits, we can learn to like the other things that are better for us.
You can't look at the end result right away. It's baby steps, isn't it?
How can you eat an elephant? One bite at a time.
That's great.
If you think about taking over a huge goal, loss of 50 pounds, let's say, it feels overwhelming. But if you think about breaking up that goal into small steps and then celebrating the accomplishments along the way, oftentimes it helps to keep you on track a little bit more, rather than thinking about, I've got to lose 50 pounds, and if I haven't lost it in 2 weeks, then I'm a failure.
But the other thing, too, is when you're setting goals, they really do have to come from you, because you know what your overall lifestyle is. So they have to suit your life, don't they?
I think that's maybe one of the big fallacies about making changes, is that we think we have to go by somebody else's formula. You know, you go to the gym and they give you this list of things you need to do when you get to the gym, and when in fact maybe there's one machine you really detest. Well, so if you skip that machine, use another one. Make your own list of things that you want to do to improve.
And, you know, doctor, I was just going to say, you know, once you've developed that list, and hopefully you're developing that with your doctor, you go out and you try it for a couple of weeks, and if it doesn't work, you should be able to come back and re-examine it and tweak it, shouldn't you?
That's part of setting forth an action plan in terms of being able to accomplish a goal, because one of the things that you'll learn is that you'll learn a lot about yourself, what you like. If you really hate that elliptical or the stair stepper, you may like the treadmill a little bit more. You may want to play with a Wii sports game or something along those lines in order to help you to accomplish a goal. So making sure that you know what works for you and what doesn't is very important.
Now, what about tracking the changes? That's really important too, is to have some kind of a log to know how you're doing, right?
You know, one of the things you can do is maybe create a chart. Years ago, my dad decided he was going to walk a mile a day over the course of a year, and he actually did it. But he kept a chart, how many miles he walked each one of those days. Weight, you can chart. If you list these things, if you cross them off on your calendar, you can see some of the changes, even if you can't see some of the changes.
Also, sharing those goals and tracking those goals with family or friends actually helps to make it a bit more concrete for you so that you know that you're being held accountable for a promise that you've made to yourself.
The other thing, too, is be realistic, because you're not always going to be successful with every goal you set. There will be roadblocks along the way, but you shouldn't let that deter you from keeping going on that same track.
You have to be forgiving of yourself sometimes.
Absolutely.
And you know, everybody, I mean, that's human nature to try to make changes, fall off the wagon, whatever it's going to be, just get back on it.
People who are trying to stop smoking usually will have 4 or 5 attempts before they're able to stop completely. But one of the things that happens is that you learn a lot about yourself and what it takes in order to stop smoking or whatever health behavior change you're trying to make in the process.
Right, and also, you know, in discussing with your doctor, you know, if you are hitting a roadblock, you know, there are so many other alternatives that are probably available to you that you didn't even know unless you bring it up.
Sharing that information in partnership with your doctor can help to reframe the particular problem that you're trying to address so that hopefully on the next attempt you'll be more successful.
It's important, too, to find a doctor who's willing to take those baby steps with you. You know, just the doctor who says to you, you got to lose 50 pounds and then walks out the door is a very different practitioner from the one who says, yay, you lost 10. Now let's work on the next 10. And then you feel like you're triumphing together.
I knew I had osteoporosis, but I thought I was handling it well. The osteoporosis had advanced tremendously in 2 years. I believe in doing everything you can do to decrease the advancement of your disease.
You may not be able to do what the next person does, but if you do what you can, when you can, you will feel much better about it.
The Living Healthy program is a program that's based on a model that was developed by Stanford University in California. And it is intended to help people manage chronic disease.
What we found out was that while the medical treatment for chronic conditions are very, very different, I mean, you take insulin or diabetes medications for diabetes, and you take heart medications for heart disease, but what is really the same across diseases, or almost the same, is how one self-manages.
We do the action plans, we discuss problems, we problem solve, we brainstorm. No one's going to do these things perfectly all the time, and your life isn't going to go smoothly. So when you don't succeed, they have taught you all these problem-solving steps.
What are some of the things that we can do ourselves to make this a better situation?
This course, this 6 weeks, just brought so many things into focus in a different way.
A lot of you people know I'm a very heavy smoker. I quit smoking yesterday.
There's nothing like listening to someone who's been there and done that and how they've done it.
Many of our current group leaders are actually graduates of this program.
We've talked about how each of these feeds on the other is like a spiral.
You have to realize when you have a chronic condition that you have the condition. It's your responsibility to get the help you really need.
You know, self-management sounds great. We know it's a challenge, and it doesn't necessarily have to be something that we do alone.
Patients come into my office for a 15, 20, sometimes a 30-minute office visit, but in fact, people manage their chronic health conditions 24 hours a day, 7 days a week, 365 days out of the year. And having the information that you need in order to manage a chronic health condition outside of a doctor's office is very, very important.
You know, if you think about it, when somebody's diagnosed with something, they're receiving that diagnosis, but there's a ripple effect on everybody else who is in their life. So now the family is dealing with it. A diabetes diagnosis, for instance, it's not just your food habits that have to be changed. The whole family's dinner table is going to begin to look different, and the snacks that are in the house are going to begin to look different. And then there are going to be the emotional parts of that. You're dealing with something new, and your family feels a little put out that they're having to deal with something new. I mean, there are all kinds of ramifications, and you have to go outside for resources.
One of the first places that I asked them to look to are organizations that are called voluntary health organizations or voluntary health associations. Places like the American Diabetes Association or the American Cancer Society. Oftentimes people think of these organizations as being places where there's a lot of money that goes into basic science research for a cure, but in fact there's a whole lay branch of these organizations that can provide personalized one-on-one support for people who've been diagnosed with a particular health condition.
I heard an interesting phrase called a medical mentor, and I loved that. But it really is an advocate for you.
I think so, and I think that I like to think of it as not just a mentor, but someone who helps you with the navigation of the system so that you can learn more about how you can manage on your own, but also can help to serve as an interpreter, if you will, because oftentimes dealing with a chronic health condition is like stepping into a foreign country. You need to learn the language, you need to learn the culture, and finally, as you start working within that culture and that country for a while, you become very proficient in living in this new phase of reality.
It really is helpful to identify a neighbor or a friend or someone who can pitch in for whatever it would need to be, whether it's transportation to the doctor's office or whether it's doing research and learning more and then explaining it to you. Or maybe it's bills. The bills are overwhelming, and that stress can contribute to whatever your problem is as well.
You know, what do you think about support groups?
Emotional stability, physical support, resources for special equipment or other needs, all of those things can be learned through support groups, either in-person support groups or support groups that exist through the internet.
Support groups are other people, typically who have your same diagnosis, or maybe you have a child with a disease and it's other mothers or fathers that had that same diagnosis. You can learn a ton, but you also are just connecting with other people who they know where your head is too.
What's the next step after someone tells you, oh geez, you have this unusually rare cancer that we do not have a cure for? You try and find the support that's necessary to deal with the fear and the complexity and the general sense of disorder.
Help. Somebody help us, because I knew that we couldn't do this alone. I said to Scott, there's that Gilda's Club, maybe there's something there.
How many calories are you up to?
I'm over 1,000 calories a day, which is greatly improved from being on 24-hour tube feeding.
Wow.
Yeah.
I walked into a wellness group, and there were people there who I knew could understand other people who have actually been through very similar, if not the same, treatments that you've been through.
I'm not sure if they realize the importance of how much they're doing for us, but they really are teaching us how to live.
The charm is sterling silver. Okay. It's stamped survivor. We say a little prayer with each one.
There are caring, loving people all over this world that are willing to help you with whatever you happen to be going through. And a lot of it comes down to being able to ask for that help.
You know, taking control and being engaged in your own health care can be quite a puzzle. But I think you are the person, you as the patient, you have to be the one that connects the dots.
Absolutely you do. And you know, one of the big problems is there are so many dots. There are the dots of the medical side of whatever it is. There are the dots of the people you need to touch base with. There are even the dots about navigation and billing problems that you might run into. But nobody else can take control unless, of course, you bring somebody in to help you. You have to manage it yourself. Your doctor certainly isn't going to do it for you.
But again, the doctor's office is a great place to start.
And oftentimes it's that informational dot that Trisha just referred to that I think is where you start in working with your doctor. Certainly he or she is a respected source of information about whatever problem you're struggling with, but also that doctor can refer you to other resources that can help you to connect the dots so that you're able to manage your illness on an ongoing basis.
Mm-hmm. You know, I know so many people seek out the internet as a place for information. Is that a good thing?
Well, you know, it's a good thing and a bad thing. I mean, the internet, it can make a huge difference in your health and in your life. But you have to be able to discern which information is credible and which isn't. And so even when you spend a lot of time researching on the internet and learning more about your disease or your condition or even just weight loss, you still need to go back and discuss all of that with your doctor. And, you know, it can be a tricky thing. You can't walk into the doctor's office and hand the doctor a whole ream full of papers that you've printed out. The doctor doesn't have time to read them, and besides, probably knows all that information.
Well, how do you feel about that when you have a patient come in with all of that?
I try to see it as a positive in that the patient is engaged and wants to be a partner with me. Having said that, I also look for opportunities to guide them towards credible sources of information around whatever goal they're trying to accomplish, whether it be losing 50 pounds or treatment of a chronic condition like diabetes or even stopping smoking.
We tend to think that medicine is one way, and there's east and west alternative therapies that can be, integrated into your health care and overall wellness plan. Tell us some strategies when you go into your doctor, if you want to introduce some things like that or other things that you found. How do you talk to your doctor?
You could say, what do you know about this? Or have you had any patients who have been successful with this? But don't just say, why haven't you told me about this, or be confrontational about the thing. Engage in that conversation.
You may be surprised because, in fact, there's a scientific basis for many illnesses being treated by alternative medical therapies, such as yoga, chiropractic, acupuncture. I've referred patients to acupuncturists to help them with smoking. For patients who have a condition called fibromyalgia, yoga and massage is incredibly helpful and has been shown scientifically to improve overall symptoms in order to promote a feeling of well-being for those patients. So you may be surprised when you ask your doctor about alternative medicine.
But you do have to be honest. And don't engage in some of those and withhold that information, because that can actually be dangerous. People take herbal supplements and then they find out later that there was a conflict with a drug that the doctor had prescribed.
Well, I think what we're really kind of focused on here is that engaged patient, that person that really looks to themselves and says, my health counts and I'm going to do everything I can to make sure I have a long and productive life. And a lot of these strategies and ideas are certainly going to contribute to that.
We were taking Bets to the doctor just for her annual physical, and she was not feeling real good for a couple of days, but I thought maybe she had strep. So they did glucose, and she was almost 400 at that point. So they said to the hospital, and that's what we did. Bets is a type 1 diabetic. Even if she does really well with her diet, she's still going to have to take insulin all the time. It was a learning experience to understand that and to see how what you have to do to keep her healthy.
Maybe we'll go low for lunch, like salad or something.
So she had to be part of that. We keep a close eye on her. We test a lot.
If it's low, you feel really shaky. You feel like you're going to be really sick. And when you're high, you feel really tired, like you're going to pass out on the floor.
Pinch there. Okay, 1, 2, 3.
She has to have insulin for every meal. Plus, she also has to have another shot of insulin in the evening. So our schedule's changed a little bit. She's, done really well at being able to figure out what's going to be appropriate and, when to eat and things like that. And sometimes she helps to keep the whole family on track.
How's that working? Good?
I think it's been actually pretty good for everybody. It's a lot healthier diet. It's pretty much all about communication because she needs to be able to, tell us what she's been eating and how things are going and how she's feeling.
Okay, let's get your stuff going. What do you need in your bag?
She plays basketball. She was on swim team.
When I go to practice or a game, I need to have my meter and a juice and a water bottle. Because if I go too low, I'd have to have a juice. But if I go too high, you'd have to have a lot of water.
She's been pretty active, and we want to keep that up because it's good for her. But then you have to count on coaches and things like that to help keep an eye on her. And we've also had terrific support at school. Her school nurse, every day she calls me to let me know what her blood sugar is before lunch. She doesn't complain. She has just kind of understood this is part of it and this is what you do.
Just keep going, never give up. And it's hard at first, but I do it because my health counts.
You can improve your care by learning more about your own conditions, asking questions, sharing your medical history, making sure you understand your doctor's recommendations, and taking the necessary steps to feel better sooner. Always remember that you are the most vital member of your healthcare team. Using the tips, suggestions, and strategies we've talked about today, you have the power to live a healthy, productive life. Take some time to visit our website and learn more. I'm Susan Hunt, and I thank you very much for watching.
Major funding for My Health Counts provided by Blue Cross Blue Shield of Western New York. Take time to exercise daily. Eat healthy and reduce portion sizes. Limit TV and computer screen time. With additional funding provided by Catholic Health. See us in a new light. Atwal Eye Care Associates. Change the way you see. And the McGuire Group, offering 24-hour skilled nursing care with 5 convenient locations in Western New York, with foundation support by Aligning Forces for Quality, an initiative of the Robert Wood Johnson Foundation, the John R. Oishei Foundation, a catalyst for change, and the Robert J. Stransky Foundation, produced in partnership with the P2 Collaborative of Western New York.